How was your flu shot?
Great. Couldn't be better.
Number one, let me start out by thanking Duane Reade for hosting us today. And just so you'll know who to blame if I keel over and die, the pharmacist was Barbara Naprawa. Barbara, where are you? There you go. Thank you very much. But if I die, my estate's suing you. I don't think, and Edwin Rivera is the store manager, and thank you very much, both of you. Flu season is almost upon us, and the best way to avoid getting the flu is to get a flu shot. It's also the best way to prevent the flu from spreading to someone else. So if you get a shot, you're not only protecting yourself, you are protecting your family members and those you love. And that's why Health Commissioner Tom Farley and I just got our flu shots. As you saw, it only takes a minute. That's overstating it. It probably took about 5 seconds from the moment she started to give it. You can get it at pharmacies, at doctor's offices, local health clinics, and hospitals. If you can't afford it, call 311. There are places that give it for nothing. There's no excuse. And you're doing something for yourself and your family. So we encourage everyone to go out and get a flu shot. Getting the flu is no fun, and it can be deadly. And the doctor's recommendation, anybody, no matter how old you are, if you're over 6 months old, you should get a flu shot. So I remember my mother, even the last year of her life at 102, was getting a flu shot. And she, I don't think, ever came down with the flu. It works, not every time, but most times. Flu can cause a number of symptoms, including fever and chills, body aches and nausea. Some of those things you get from reading the newspaper, but that's okay. Just, that was for you, Saul. And while the flu can be debilitating even for someone in top physical condition like I am, it is usually toughest on children and seniors or people whose health may be compromised. In fact, along with pneumonia, the flu is the third leading cause of death in New York City. Just think about that. Third leading cause along with pneumonia. So when we say getting the flu is dangerous, it really is dangerous. You don't think so, but if you come down with it, all of a sudden you're going to say, why did I not get the flu shot? And it's so easy, so quick. It doesn't cost much, and even if you can't afford to pay, you can get it. If you think you can handle getting sick during flu season, think about your children and your parents or someone you come in contact on a regular basis. Now, more than a third of people infected with the flu virus won't have any symptom at all, but they can pass this on to others. So even if you say, oh, well, I'm not going to get sick, and you look back and you say, hey, I wasn't sick. See, I didn't need that. For all we know, you infected a lot of people that you work with, the people that you live with. In addition to getting vaccinated, there are two things everyone should do to stop the flu in its tracks. Number one, wash your hands regularly. The flu virus can live on hard surfaces like doorknobs, umbrella handles, tabletops, subway car surfaces. So during the flu season, it really is particularly important that you wash your hands with soap and warm water. And number two, cover your mouth when you cough or sneeze. Placing your mouth into your arm, which is not particularly nice, but better than giving somebody the flu, or covering it with a tissue or handkerchief will help cut down the chances of you spreading the virus to others. And with that, I'd like to welcome our Health Commissioner, Tom Farley, to share a few words. Tom?
Great, thank you. Just a couple things. There are two infectious diseases that kill the most New Yorkers: HIV infection and influenza. And we know how to protect ourselves against HIV infection. The way to protect ourselves against influenza is to get a flu shot every year. Now, some people are particularly high risk to die from influenza. Those would be people over the age of 50 or children under the age of 5. And in the past, we recommended that those people get vaccinated. But in recent years, we've broadened the recommendations so that everyone should be vaccinated every year. And there's two reasons for that. First is because even young, healthy people can get serious infection with influenza. They can die from influenza. And second, as the mayor said, if you don't get influenza, then you're not going to spread it in the community. And if we can increase the overall rates of influenza vaccination, we might blunt the epidemic across the city. We know we have an influenza epidemic every year. We know it'll happen, but the virus changes every year. This year, the vaccine has 2 new viral strains in it to protect against the strains that we expect to come here in the city. So if you got vaccinated last year, you still need to be vaccinated against this year. So get your flu shot every year, and it's never been easier. Pharmacies are available all over the city. You can go to nyc.gov/flu, and then you can search for clinics where you can get it for free. So get your flu shot.
Let me summarize today's announcement for our Spanish-speaking New Yorkers. Es importante prevenir la gripe o influenza, particularmente para los niños, chicos y las personas mayores. Cubra sus tos y tome precauciones como evitar contacto con personas enfermas y lavar sus manos con frecuencia. También es importante recibir la vacuna contra la gripe cada año. Es la mejor forma de prevenir esta enfermedad que puede ser fatal para muchos neoyorquinos. And with that,